At Eisenhower Health, COVID hospitalizations are down, but doctors continue to worry about younger and sicker patients. And there are new developments with the vaccines. I spoke today with Chief Medical Officer Dr. Alan Williamson. Dr. Williamson, first off, what's the latest at the hospital?
Hi, Peter. Good to see you again. We are doing pretty well. Things have tapered down just a little bit. So we're averaging now typically about 25 patients or so per day, down from our high on this surge of around 50 to 60 patients. Still seeing a spread where we are seeing some younger patients than we were seeing in the first two waves. And in general, the patients tending to be sicker than what we have seen before. So still worrisome, still requiring quite a lot of energy to try to care for these patients, even though the numbers are down. But we are encouraged to see the numbers coming down.
I'm curious, have you seen any children hospitalized with COVID?
Yeah, so far we don't have any children here hospitalized. We would not take care of seriously ill children here in the hospital anyway. We don't have a license for intensive care beds for pediatrics, for example. So those patients would have been transferred up to, likely up to the Children's Hospital. So we have not seen any pediatric patients here.
Pfizer says that its COVID vaccine is safe and effective for kids now as young as 5 and will seek authorization soon. Your thoughts, and does the hospital have any plans if the government does give children the green light to get the vaccine?
So yeah, I think, obviously that's really important news. That's become really the target of this virus. Lately, it seems to be the pediatric population as kids are going back to in-person learning. We're seeing about 1 out of 4 cases in the country now are in pediatric cases. So it's obviously important that we try to get those kids vaccinated as soon as we possibly can. Currently, the Pfizer vaccine has full approval for adults. It has approval under the emergency use evaluation approval process for kids from 12 to 16. And what you're seeing now in the news is that Pfizer has released their data of what's called a bridging study to show that by vaccinating the kids from 5 to 12, that they get the same immune response, the same antibody response that we've seen in the adults. So it's not a full study looking at the children. It's just looking to see, do we get the same antibody response and does it appear to be safe? That's still obviously very important information, but it's still preliminary at this point. This has not gone to the FDA, even to the advisory panel of the FDA. So that would be the next step, is for Pfizer to go ahead and send that data to the FDA. And as we know, just even from the most recent go around with the boosters, what's public opinion doesn't always necessarily reflect what the FDA decides. As the FDA is driven very much by science. They're going to look at the data themselves. They're not going to listen to what people want to opine about what the data shows. They're going to look at the data, study it very closely to be sure they understand exactly what the implications are of the data that they're being presented to, and then make their decision. I do believe that ultimately they're going to find that this is safe and effective in kids as well. Probably the biggest challenge with children is understanding what's the appropriate dosing for them, because it's not really appropriate to just assume that a child is just a small adult. That's just a matter of their size or their weight. Their immune systems are different than adults, and a number of other factors that we need to weigh into determining what's the safe and effective dose for these kids. But I'm hopeful in the next couple of months we're going to actually see the FDA and CDC making their guidelines and approving a vaccine for kids. Our challenge right now, and we're looking at this also for the boosters, is that in the first few phases of this disease, the business in the hospital had slowed down so dramatically for non-COVID things. And we were using a lot of telemedicine and so on. Our clinics were very slow because people didn't want to come in and see the doctor because of fear of COVID. And as a result, we had staff that we could then repurpose to help provide the staff to run mass vaccination clinics. So, as you and I have discussed over previous interviews, we were up to 2,000 patients a day at one point that we were able to vaccinate. Now we're finding, at this point, the clinics are extremely busy. The hospital's been very, very busy. This is the busiest summer we've ever had in terms of the number of patients in the hospital. And it's not just because of COVID. We have many factors that are feeding into this, but it's been a very, very busy summer. So our current challenge is really going to be to understand how we're going to staff these clinics. So we are, obviously committed to doing everything we possibly can to trying to be sure the public gets those boosters when all of this is settled, and when we have the guidance from FDA and CDC, which should be forthcoming this week, at least for the over 65-year-olds and some of the high-risk individuals as well.
I also want to ask you about Johnson & Johnson. Johnson & Johnson now says that 2 doses of its vaccine delivers 94% efficacy against mild to severe COVID. So how does that change, or does it change anything at the hospital? And do you anticipate that people who received the Johnson & Johnson vaccine will now be coming in and asking for a second shot?
Yeah, obviously all of this is evolving, and that's preliminary data coming from Johnson & Johnson. As I said a minute ago, all of this will have to go through the process with FDA. So as of yet, they've not even actually requested authorization from the FDA. So they'll need to present that data to the advisory committee of the FDA that looks at this. They then make proposals, recommendations to the full FDA, and then the CDC helps to clarify guidelines on exactly what this means. I think Johnson & Johnson obviously wants to continue to be into this market of delivering this very necessary vaccine. And that's all going to be important information for us to weigh as we move on to see how do we deal with hopefully finally stamping out this disease.
Also, can you tell us what percentage of hospital workers are vaccinated? And has the hospital had to terminate or take any sort of disciplinary action against employees who refuse to get vaccinated, or have there been any resignations because of the vaccine requirement?
That's a great question. And so there is a mandate in place from the California Department of Public Health that as of the end of this month, all of the healthcare workers must be fully vaccinated, with the exception of those that have a valid medical or religious exemption from being vaccinated. And then they have to have periodic testing and wear special masks and so on. Fortunately, we were already quite ahead of the curve in terms of getting our employees vaccinated. And with that extra impetus from this mandate and so on, we're seeing really pretty good compliance across the board. We are over 95%. I have to check the data this week, but I looked as of last week. I know we were over 95% of our employees are already fully vaccinated at this point, or at least have received their first shot. There are a few of those that are due to have their second shot within the next week or so. And we are currently working through the process of a number of the remaining 3, 4, 5% of people have submitted either medical or religious exemption applications. We're working through those to be sure we understand whether or not they meet the criteria that has been set out for those exemptions by the state. And then also working with those individuals to understand whether there is are there any kind of measures that we need to take to protect them and to protect the public because they've not able to be been vaccinated. So are there accommodations that can be made in terms of changing their job duties and so on? So a lot of work in that regard. To the best of my knowledge, we have not terminated anyone yet based on these mandates because we still have until the end of this month. We have had employees that have resigned during the course of this COVID pandemic because it's been a difficult and exhausting pandemic to deal with. And so it's a little hard for me to really be able to tease out specifically whether individuals have resigned because of the mandate alone or just because of some of them are older employees and have decided now's the time to retire because it's just too hard to keep working at the pace that unfortunately we've had to work at over the past year and a half.
All right. Dr. Williamson, we appreciate your time. Thank you so much for joining us.
Thank you again, Peter.
And let us know your thoughts. Has your child already received a coronavirus vaccine, or are you waiting for further approval? Let us know by taking our latest poll on our website, kesq.com.